you, sir. Good afternoon, respected panelists and honorable audience. I welcome you all to my talk on orbital sinus mucocele and outcome of management. And I'm most thankful to Ophthalmological Society of Bangladesh and All India Ophthalmological Society for inviting me to share my experience in this subject. And I have nothing to disclose financially. As you know, the sinus mucocele, it is formed by the respiratory epithelium, and it's formed due to poor drainage of the obstruction due to some many causes like infection, inflammations, and so on. Among the all parietal sinuses, frontal sinus is the commonest that's from which mucocele may arise. This is the second most common is ethmoid, though most of the cases combination of frontal sinus and ethmoid sinus are usually seen. Maxillary and sphenoidal sinuses are very less common to be involved. These sinus mucocele may become complicated when they have extended into intracranial space and also the intraorbital space. And our presentation of the sinus mucocele depends on the involved sinus. In case of frontal sinus mucocele, most common presentation is severe proptosis, and when there is associated with ethmoidal sinus component, then may be associated with the dystopia. And these huge proptosis may lead to exposure keratopathy leading to the loss of vision. Some other less common presentations caused by sinus mucocele, these are muscle imbalance, image distortion, and some less common cases, visual field change and vision loss, though these are usually rare except from exposure keratopathy. And some sinus mucocele may present as other lesions like arachnoid cyst. This is an interesting case of arachnoid cyst treated in our department. This case later on diagnosed as arachnoid cyst, later managed by our neurosurgeon colleagues. Now, sometimes from sinus mucocele, the content may undergo spontaneous absorption, leading behind a fibrosed sinus mucosa. In this patient refuses further surgical reconstruction. Now, definitely surgery for the sinus mucocele is surgery. Treatment is surgery, and this surgery can be done in both external approach and by the endoscopic approach. And then we usually prefer mucocele removal by external approach, and endoscopic approach is commonly preferred by ENT surgeons and sometimes neurosurgeons also. And this patient with huge frontal sinus mucocele presents with severe proptosis of reduced vision from prolonged and neglected case of mucocele, and after surgery by external approach, good outcome was there, but his vision is remain reduced because of macular scar. And now these are few examples of ethmoid sinus mucocele, extensive ethmoid sinus mucocele, nicely bandaged with external approach, leaving behind no sequelae. Now, from sinus mucocele may pose a diagnostic challenges, especially in case of very early stages. This patient present with mild proptosis and occasional having mild pain. And on scanning, you see there is very less the irregular shadows in the supromedial part of the orbit. So we have planned for further exploration. On exploring, there is a very early case of frontal sinus mucocele. As in early stage, there is no bony covering, so sometimes diagnosis may be missed. This is an interesting case of giant frontal mucocele, and on the neglected case, the after surgical removal by external approach, this patient there's a residual the sequelae of deformity in the frontal bone. This is the third postoperative day. Later on, the eyeball remain its normal position, though the defect in the frontal bone is still there. Now, surgery on the frontal sinus mucocele have their complications also. Recurrence is being the most common complications. Others are vital structure damage, which is most commonly encountered in endoscopic approach. Sometimes there may be biocele formation in postoperative period when there is associated with the infections. And to prevent this, this is an interesting case of recurrence. After doing primary surgery on the frontal sinus mucocele, patient presented with discharging sinus in the orbital roof, and after undergoing several procedures, then after all the case is managed, but through a complicated procedure. This is another case of huge frontal sinus mucocele having several times recurrence, though ultimately the patient was doing well. And for preventing recurrence, the important surgical steps are proper clearance of the sinus content, establishment of the normal drainage by stenting, though we are not using any stenting, and the dead space of the mucosal obliteration that may be obliterated by autologous fat graft. This patient presented with the frontal erythema sinus mucosal with severe dystopia. That is, patient is having acquired telecanthus, and after planned incision for further reconstruction of the telecanthus, that is reconstruction of the medial canthus, aspiration of the sinus content is very important, and this mucosal is having the special characteristics of having multiple septate appearance, that is separated by the thin pieces of bone and associated with the hyperostotic bone. Then after removal of this bony septa, entire sinus mucosa has to be clearly removed out, because if there is remnant of any sinus mucosa, there is every possibility of having recurrence again. And this mucosa has to be nicely carried out, because there should not have any remnant. And after removing this mucosa, the trimming of the hyperostotic bones has to be done to provide almost a near normal appearance. And postoperative drain tube has to be placed there. Though we are not using any stenting for prevent recurrence, these cases are doing nicely without any stenting. For prevent recurrence, we did another procedure. This young lady presented with the hyperostotic lesion in the supermedial part of the orbit, and with CT scan showing almost absorption of the sinus content, with leaving behind a small hypertrophic sinus mucosa. And after exploration, the removal of cap-like hyperostotic bone is removed. Almost there is no sinus secretions. So residual sinus mucosa was removed, and abdominal fat was was taken, and the cavity of this mucosal cavity was filled with the harvested abdominal fat. And this is the post-operative appearance, and this patient is nicely doing well with good satisfaction. Now, in conclusion, we can say that this orbital sinus mucosal poses same diagnostic and therapeutic challenges as other orbital tumors. Treatment is highly individualized because presentation is different, and definitely outcome of endoscopic approach is excellent, but the good and meticulous surgery through external approach may provide a good outcome as well as endoscopic approach. Now, I must thankful to my mentor, my teachers, my department, National Institute of Ophthalmology, where I have taken my training, and also OSB and AIOC. Thank you, and welcome to my beautiful country. Thank you.
Thanks, Dr. Mukti.